Hello, my name is Dan Malin. Welcome to Allied National's Basics of Level Funding. We're really pleased that you've decided to take a few minutes and learn more about our Funding Advantage product. This webinar is intended to be basic training for level funding. We're going to go through some large picture issues and give you a brief overview. There's a lot more to this than what we're going to cover today, but you're going to get a basic overview of what level funding is about. So there we go. So what I'm going to cover today is Allied National, who we are, our underwriting philosophy and methodology, a little bit about underwriter relationships, how do you obtain final rates, what kind of commissions are we paying on our products, and about renewals. So we're going to cover all those subjects in some detail here. Let's talk a little bit about Allied National for a minute. Who are we? We're a family-owned third-party administrator. We've been around for 45 years. And we look, feel, smell, and act like an insurance company. We provide underwriting for medical risks, small group level funded plans. We do our own claims administration. We issue policies, do policy service, collection, and billing of premiums. We have our own actuarial staff. We have our own compliance staff. We do our own product development. We develop products for the carriers we represent. We do case management. We manage our own medical cases. We do sales and marketing, and we have a legal department that deals with regulatory compliance and legal issues that evolve out of administration of insurance. So Allied National looks, feels, smells, and acts like an insurance company. However, we do not take risk. Our risk partners are Fidelity Security Life. When you do a program with us, a level funded program, the paper that the stop loss contract will be issued on will be Fidelity Security Life, but they only take a very small portion of the risk. They provide all the filings in the various states where we do business, but the primary reinsurers on all of our business is Swiss Re and Axis Capital. And Swiss Re and Axis Capital are very large reinsurers. Their combined equity is $41 billion, and they have approved our underwriting manual, and we take risk on their behalf. If you'll notice here, they're showing $41 billion of combined equity. Aetna and Cigna combined are smaller than Swiss Re and Axis combined. So we have some very, very strong reinsurance partners. Our underwriting philosophy is pretty interesting. We don't really offer insurance. What we do is we deliver healthcare risk financing. I'll say that again, healthcare risk financing that eliminates catastrophic exposure for the small employer. So what we're doing for small group level funded health plans, we really try to accomplish 4 objectives. The first thing is we want to determine the cost of healthcare for the group. We do that through our medical enrollment form, which we will talk about in a little more detail. We protect the employer from any catastrophic health risk exposures through the placement of a stop loss contract. We also allow the employer to retain any potential underwriting profits by virtue of the fact that a portion of the dollars that they give to us in the form of premiums are set aside into a fund which they receive back if all those dollars are not paid out. And then finally, we provide tools to the employer to manage their healthcare risk. So again, we don't really deliver insurance in a traditional sense. We deliver healthcare risk financing that eliminates catastrophic exposure for the small employer. Our philosophy also looks to the future. We do not look at the past history of claims for the particular employer. What we're basing our costs or our rates on is what we predict as the future health cost in this plan for the next 12 months. And again, we'll talk about that in some more detail in a few minutes. But again, I want to emphasize what we do is deliver rates based on our projected future health care costs for this particular group. Funding Advantage is really alternative funding or self-funding on training wheels. We go down to 2 lives. The program's ACA compliant, and it's what we call level funding, but it's made simple. All the documents that are they're prepackaged. The plan docs, the specific and aggregate stop loss, all of it come in a prepackaged format. Terminal liability is included, so there's no future exposure for the employer. The plans are medically underwritten, and there's a provision in there called accommodation, and I'll explain accommodation on a later slide. This is a one-page sheet graphic that basically explains level funding on one piece of paper. We have gone into an employer, and in 10 minutes, they have understood exactly what they were getting into. So let's talk about this and spend a few minutes on this slide. This particular employer is spending $122,621. That is their maximum liability for the year. So they're going to pay that in over 12 months, but we're going to distribute those dollars into three buckets. The first bucket is $53,681, which is represented by the green box here. That is the employer's claim fund. Then there's the dark black line across the chart here, which is what we call the specific attachment point. And that's where stop loss insurance attaches. So above $10,000 of any one claim, the stop loss carrier is going to pick that claim up. And then there's $22,072 that goes for administration and sales. That is what gets paid to Allied National for their administrative services, and for you, the agent, to get paid your commission. So let's see what happens when we have a claim. And then this is a $25,000 claim here. This is this vertical bar. The employee has paid their deductibles and copays, and we have written a check out of the employer's claim fund or checks to pay providers for the first $10,000 from the employer's claim fund. Once we've paid $10,000 out, then those future dollars or other dollars on that claim in excess of $10,000 are then paid by the stop loss carrier. The $4,000 claim and the $9,000 claim are both paid entirely from the employer's claim fund. Now we have a $45,000 claim here. Again, the employer's obligation is only $10,000, and then the carrier paid $35,000, $6,000, and $4,000. So if you add all those yellow boxes up, you're going to discover that $43,000 has been paid out. So we put in $53,681, which means we have $10,681 left. Allied National is one of the only companies that actually writes a check for $10,681. We do not take any back charges. We don't do administrative fees, and each policy term stands on its own one-year policy. We don't mix policy years, so there's no run in or run out into another year. Each year stands on its own merits. So if you look here, you'd say, okay, claims paid by the claims fund, $43,000, 35 and 50. The stop loss carrier paid $50,000, and the claims fund returned $10,000 to the employer. Now, the question is, what's the worst thing that could happen to this employer? Well, there would be 3 more claims, and we would have absorbed $10,681. Notice here, claims fund, $53,681. This is what we call the aggregate attachment. If we spent all that money, then the stop loss carrier picks up anything above the $53,681. So the employer's liability is capped on this plan at $122,621. If you need more information about this, you're free to call the the sales department. There will be phone numbers at the end of this presentation of the contacts and the people that can help you understand this better if you have any questions. So we talked about accommodation a few minutes ago, and the question really becomes an accommodation. What happens if we have more claims coming out of the claim dollar fund than the employer has put in up to the point? So let's say after 2 months you've put in $10,000 in your claim fund because you're paying 12 equal installments here, and all of a sudden you have $20,000 worth of claims. The carrier then accommodates you by loaning the money into the claim fund on behalf of the employer, and those dollars are then paid out in a timely manner. The employer repays those dollars back from future monthly installments, but their maximum liability is still that $53,681. So also, we're going to provide detailed monthly claim reports, so you can see exactly how much money is left in the claim fund at the end of any given month. And then finally, this is a 12/21 contract. Claims incurred during the plan year are payable for 9 months past the end of the plan year. And at the end of the 9-month run out, all remaining claim funds belong to the employer. Again, we do not make any terminal liability charges. We don't do administrative charges on any claim funds that are due the employer. And any claims that might manifest themselves that nobody knew about when we closed out the plan year, that happen after the 21 months Allied National sees to it that those are taken care of. This is an example of an accounting report that will illustrate what the balance is in the claim fund at any given month. So we start with the beginning balance here and then the employer contributions. So this employer in November of 2012 contributed $6,915. Subsequent months, they contributed amounts of money, and so they contributed a total of $55,605. Year to date, so far, we have paid $36,000 out of that claim fund. So right now, the employer has a $19,203 balance in their claim fund. This report's available on a self-service site that can be accessed by the agent and by the employer every month. So you can keep track of exactly what the balance is in the claim fund. The other question that arises is, what are the specific attachment points? That's the black line across the middle of the example that we gave a few minutes ago. Under 20 lives, 19 and under, the attachment point is going to be 10,000. Once we get above 20, then we're willing to be somewhat negotiable. We can do 15 or 20,000 attachments, and then 20 or 25. As the case gets larger, we can go with higher attachment points. The other thing Allied National is known for is we literally have 6,000 different plan design options. Now, we don't show you all 6,000. What we do is we show you the option that you want. But the good news here is if we need to get to a certain rate, we can customize the plan based on all these different options to actually meet the employer's need to reach a certain price based on deductibles, copays, coinsurance, RX options, deductibles, etc., out-of-pockets and copays. And there are multiple options. And once you get into a case and you've gone through underwriting, you can have a conversation with an underwriter, and they will help you to understand where you could save a few dollars by changing a couple of the smaller aspects of your benefit plan. One of the questions you ask is, why are we doing level funding? Well, level funding follows medical trend, and right now medical trends running between 9 and 10% per annum. The fully insured rates are growing, and what was a $300 rate in 2015 is eventually going to be by 2020 a $700 rate. Level funding, since it's following trend, is going to be less than that. But if this dotted line represents an employer who has had a level funded plan and received a few dollars in refunds every year, has actually reduced their cost below what they would have spent in the fully insured world. So let's talk about our desirable risks. We were looking at group sizes from 2 to 200. Our prime target size is 50 to 99. These are not limitations. The limitation is really because we require medical underwriting and we require an enrollment form on every person in the group. The size of the group is limited by the number of enrollment forms that the employer wants to complete. They must have stable financial condition, motivated to control cost. There has to be a commitment from management because there's a little bit more involvement in selling a level funded plan and managing it on management's side from the company, from the employer perspective, and you must meet underwriting criteria. So we have certain ineligible risks. We will not do municipalities, public institutions, or religious organizations. All these groups are ERISA exempt. Our one excluded class is law firms. And because a husband and wife group is not considered ERISA qualified, we can't write just a husband and wife group. We must have one statutory employee. So it can be a husband and wife, but it must be one statutory employee, and they must enroll in the plan. They can't just be an employee that waives. Also, if you had a CPA firm that was all partners, we must have one statutory employee, cannot have just an owner-only group. There's a vital important thing that needs to be understood here. The employer is the fiduciary for this plan. What does that mean? Well, this is actually the employer's plan. They are, in essence, the insurance company. This is a self-funded plan, but this is a self-funded plan with a cap. But the real issue here is what happens if the employer fails to pay the premium. Non-payment of premium or non-payment of a monthly installment triggers termination of the stop loss and administrative services. But it doesn't just terminate them on the day of the termination. It actually takes the stop loss and administrative services away immediately for all current and future claims. which means now the employer is exposed 100% to all outstanding claims that are out there. You can buy fiduciary liability. It's available through some casualty companies, but at the end of the day, it's not going to cover you for failure to pay a premium that's due. There's some more teeth in this particular situation. If you have any questions about fiduciary liability, please call our sales department. We can explain further. The other thing with medical underwriting, since we are medically underwriting every belly button in the group, the question becomes asked, what happens if somebody fails to disclose medical information or doesn't tell us about something that's going on? There's two possible negative consequences. The coverage can be terminated by the employer for misrepresentation. And you notice I said the employer can terminate it. Allied cannot terminate coverage, but what we can do is we can reform the contract, which means if we discover that there has been a misrepresentation, we have the right to go back and change the rates. We have one we're currently working on where somebody failed to disclose a medical condition, and the rate increase to cover that medical condition is about 500% of the current rate, which was at about $400 per employee, is now going to go to $2,000 per employee. But the employer has the option to terminate that employee for misrepresentation. So not sure where that's going to go. It does not happen very often. Maybe once in 20,000 lives does that happen, but occasionally it does happen. So let's talk about our rating methodology. From 2 to 9, we're going to have what's called age-banded rates with medical underwriting loads. 10 to 100 is composite rates with medical underwriting loads. And over 100, we can do experience rating, but we're going to farm that out to another entity that we're related to. We will generate composite rates for that over 100 group through experience rating instead of medical underwriting. We have that capability. So what about electronic enrollment? Well, we have 5 different electronic enrollment methodology opportunities. Allied National, we have our own online enrollment platform. And if you would call Jill at that phone number or email sales@alliednational.com and ask us, we will help set that up. There's a process to it. We'll also accept FormFire applications or enrollment forms on Easy Apps, eHealth, or eCentral. The other thing I will tell you is that we are very open and willing to take paper enrollment. We recognize that there are people out there that would rather do paper for a whole variety of reasons. So we'll accept paper enrollment, and we'll accept a combination of paper and online enrollment on a group. If you have any questions, call us about it. So let's talk about an introductory rate. This is what we formerly called a street rate. It's based on the initial census and a benefit plan design. It's a basic quote with no underwriting load. You can be set up in your offices to run a basic quote, or you can send us a census and a plan design, and we'll be glad to run it for you. But keep in mind, rates are going to increase based on underwriting conditions. The introductory rate is never a final rate, okay? Then we have a provisional rate, and this is what we earlier called an enhanced pre-screen. You would do in approved signed enrollment forms, either electronic or paper, and we have to have an employer statement and current rates. And then what will happen is the underwriter might call a couple of employees or the employer to find out what's going on with particular employees and their medical conditions. Once we've gone through this, you're going to get a provisional rate. As long as there's no material changes in the group or in any undiscovered medical conditions, the provisional rate could become the final rate. It's not a final rate until all required documents have been submitted. So, and that's what we call a signature rate. A final rate or signature rate, we need accurately completed allied enrollment forms. It could be online or paper. We need the plan sponsor statement. And then we need waivers. Any waivers that are going to need to be executed. At this point, we're going to start to look at participation. If you're under 25 lives, we're going to require wage and tax. Anybody who's COBRA eligible needs to complete an enrollment form. And we also want you to complete what's called an allied account transmittal form. Most important thing about that account transmittal form, it determines how much you're going to get paid, because there's a commission percentage slot on that form that needs to be completed, and that needs to be sent in with every submission. And then we'd like to see current renewal rates, and if you had proposed Allied and used our proposal system, we want to see the proposal that the employer accepted so we can match the benefits with our final rate. Once we have all this information, the underwriting team contacts the employer, gets permission to talk to selected employees and determine the status of their medical conditions. If you're an agent and you decide, you know what, I don't want Allied talking to my employees on this, then we're done right there. That is an underwriting requirement by our stop loss carriers. Now, we're not going to talk to every employee, but we are going to look at the medical conditions, and we're going to contact specific employees about their specific medical conditions. All of that is done in a HIPAA-compliant environment. Our underwriters literally talk to hundreds of people a week about their medical conditions, something we do all day, every day. So what is the outcome of all of this? Well, we're going to calculate the medical consumption of every belly button in the group for the next 12 months. And this is what we call a medical load report. Johnny works for ABC Construction. His spouse, Janie, is on the plan with him. And this is an HSA qualified high deductible plan with an integrated RX formulary. The PPO is PHCS. It's $2,500 deductible, 100% co. And what we're looking at here is office visits, RX consumption, and major medical. So we have taken the medical application for Johnny and Janie here. Janie has got some anxiety disorders and panic attacks, and she's taken a med for that. She's going to have 3 office visits and 4 doses or 4 prescriptions at $1,421 of total cost. And then Johnny is your typical basket case diabetic. He's got gastrointestinal issues, anxiety disorders. He's taking injections for diabetes. He's got allergies, and he's got about $5,000 worth of meds that he's consuming. So Johnny looking like he's going to have about 9 office visits. But if you look over here on this column, there's a $100,000 pooling charge, but there's a 3% chance that Johnny's going to become one of 100 people. Or there's 3 chances in 100 that Johnny is going to have a catastrophic event. In other words, if you put 100 Johnnies in a room, 3 of them are going to have a catastrophic event. So inside the final cost we have for the 2 of these people, we have a $3,000 pooling charge for Johnny. And then we also rate for unknowns, which drives the rate up to $14,429. Now, the question is, what does this do to the overall cost of the group? Well, it's a little bit, it's not as easy as yes or no or how much is it. What you have to understand is in a group of 5 or 7 people, Johnny and Janie will show up and will cause a rate to increase substantially. In a group of 40 people, these 2 people will have very little impact on the rate. And if you want to know more about why that is, please pick up the phone and call us at the sales department. So let's talk about participation. Participation, 75% required after valid waivers, 50% of all full-time employees, and we want to look at the wage and tax under 25 lives. If there's a waiting period, whatever the employer's policy is, anybody that's is a pending employee to come on the plan has to complete an enrollment or a waiver prior to getting a final rate. There's a 60-day grace if the plan falls out of participation, and the small groups must have 1 statutory employee. Again, no owner-only groups. Now, Allied only requires the employer to contribute 25% of the employee-only rate. However, we recommend very strongly that the employer contribute 75% of the employee-only cost to achieve desired participation. You're probably not going to get a 75% participation if you're only contributing 25% of the employee-only premium. So we recommend 75%. Once all this is done and the contract is getting ready to be issued, this is the final rate. This is the rate at which the contract will be issued. So how do we build relationships with underwriters? Well, it takes time. The first thing that has to happen is, as the broker, the more accurate and complete your submissions are, the quicker this process is going to work. We'd like you to send a narrative. Tell us if you're the incumbent. Tell us if this is new business to you. Tell us what the employer is looking for, what issues and concerns they have, et cetera, et cetera. We also, once we return any questions or missing information to you, you need to bring back the information in a timely manner. One of the things that happens is, once we do the beginning underwriting process, we'll send you an outstanding requirements letter, which is the things that are missing in the paperwork you sent us. As fast as you get them back to us, will determine how quick you get your final rate back. Deal with facts, not emotion, and discuss risk, not rate. At the end of the day, we are looking at the risk. You know, another 2 or 3 points, you know, it doesn't matter as far as that goes. We will help you get to a lower rate, but only by shifting the plan design. You want to ask the underwriter, you know, what's driving the rate for this particular risk. They cannot give you HIPAA sensitive information, but they can tell you generally what adjustments to the plan design might offer you the best consideration. I had one yesterday where we added $150 to the brand drug RX as a deductible. Most people were taking generic, and we reduced the office copay from unlimited to 4, and that took 6% out of the rate. So we're willing to talk to you about what can be done to reduce the rate, but once the risk has been priced, we are not going to reduce the price of the rate because we need to have that money to cover the risk exposure. We expect you to know your employer and know what they're wanting. Interestingly enough, these underwriters do a lot of work on your behalf. They're going to spend right at 1 hour per belly button or per employee, enrolled employee for every enrollment form and process that they work on. And as a result, they'd really like to write your case. So they want to win too. Talk to them about what you think needs to happen in order for there to be a win. If we can't get there, we're going to tell you. Build a relationship and earn trust. Our top 10 or 12 producers know our underwriters very well. They have about a 90% closing ratio, and they've built a line of communication and a trusting relationship with our underwriters. They are very matter of fact, and they understand the process very well. So building underwriter relationships, first thing, accurate submissions, narratives, timely responses, deal with facts, know your employer. Our underwriters want to win, help them help you win. And then we want to build a relationship with you and earn your trust. We want you to earn our trust. Commissions. Commissions. The default commission under 25 lives is 6%, and then you can see how it's ratcheted down until you get over 150 lives. Now, a couple of things about this. If you happen to be going through one of our GAs, it does not impact your commission one way or the other. The general agents are paid by Allied. The other thing is these commission percentages are not etched in stone. If you have a 50 life case and you want 7 or 8% commission, you have to tell us, but the way you tell us that is on the case transmittal form. So be sure you make yourself aware of the case transmittal form and use it when you submit a case. Renewals. We'll offer renewal on every account 60 days prior. If it's a case we don't think we really want to renew, you will get what we finally call as a go-away rate. However, you will get claim fund information, large claims experience, renewal adjustments, and the underwriter comments. So at some point in the future, we will do an entire webinar on the renewal process. But to make it simple, 60 days prior, you're going to get a packet of information, and it's going to have a lot of information that most small employers have never seen if they've been fully insured. So you're going to need to take the time to study it. And if you have any questions, again, call the sales department, and we'll be glad to help you walk through it. Our renewal retention in 2017 was 81%. Average rate increase was 17.2. Now keep in mind, in that 17.2, there were some that were 40 and some that were 5. So it averages itself out, but that's across a block of business that involves well in excess of 20,000 lives. So the average rate increase was 17%. 4 cases we retained in December averaged a rate increase of 90%. So you can imagine what having a 90% rate increase does to the overall average. Service. We have a very robust client services department, but there are also self-service sites, and you can access them through our website. The employer self-service site, member and agent self-service site, there's a lot of great information that can be accessed by all 3 of them, employer, member, or agent, on those self-service sites. So let's close by kind of recapping why Allied National in 2018. We do level funded health plans, 2 or more lives. We provide detailed claims data on all groups. Our rating methodology is proprietary to Allied. Nobody else does it our way. And our stop loss reinsurance carriers are A plus 15. They're larger than Cigna and Aetna combined. We did not talk about reference-based pricing with our no balance bill guarantee in this webinar. There is a separate webinar that you can watch called the Freedom Plan that will explain that in great detail. We have 1221 contracts. 50% of our cases receive refunds. That means we're sending money back at the end of the 9-month period. After the end of the policy term, we calculate the refund and we send that in the first week in the 11th month. We have an 80% renewal retention. We have employee engagement tools and cash rewards. We also have a webinar. It goes for that subject. It's under Member Connect, and we're in the process of upgrading some of those engagement tools. We also will coordinate our plan with Direct Primary Care. There is a webinar for that called the DPC WRAP plan. If you'd like to know more about Direct Primary Care, you can watch that webinar, or you can call us and we'll explain further what that looks like. This is a privately held company. We're 45 years old. We have a very stable employee workforce. The average tenure of 15 years. We have people that have worked here for 40 years. And then finally, we also offer individual limited medical and short-term medical contracts. We're one of the largest administrators of short-term medical contracts in the country. So this is our website, alliednational.com. Everything I've talked about here today is on this website. If you go to the agent tab and drop down, there'll be a drop-down menu here with all sorts of resources on it. I would highly recommend, if you're going to do business with us, that you take the time to know what's on our website. Almost everything that you need to get licensed, to quote a case, to issue a case, to find out about your client and what Allied National does can all be accessed through alliednational.com. So finally, on behalf of our sales staff and our marketing staff, I'd like to thank you for spending a few minutes with us. Again, my name is Dan Malin. I'm the National Sales Director, and my phone number is here. There's 5 other people on this list besides myself, all of whom are well qualified to answer any and all questions concerning the Funding Advantage product. So without further ado, I'd like to thank you for taking the time to listen to Allied National's Basics of Funding Advantage. Wish you well, and please call us. We'd love to provide some quotes and write some business for you. Thank you very much. Bye.